from BSN1C, and for today's video, I will be doing the bed bath. Bed bath is the washing of the patient on bed with soap and water. Assessment. Assess the patient's tolerance for activity, discomfort level, cognitive ability, and musculoskeletal functions. Number 2, discuss patient's preference for the bathing procedure and personal articles. Number 3, assess the patient's skin for dryness, redness, or areas of breakdown, and gather any other appropriate supplies that may be needed as a result. Objectives. Number 1, to decrease the possibility of infection by removing excessive debris, secretions, and perspiration from the skin. Number 2, to provide comfort for the patient, to assess the patient's overall status, skin condition, level of mobility, and comfort. Number 4, to maintain muscle tone through active or passive movement during bathing. Equipment: wash basin, bed linen, personal hygiene supplies such as deodorant and lotion, soap dish, bedpan or urinal, towels and washcloths, bath blanket, gown or pajama, laundry bag or cart, and disposable gloves for anal and perineal care. Good morning, sir. I'm Pia J. Araujo, your student nurse for today, and I will be doing the bed bath. What is your name, sir?
John Alfred.
John Rofer.
Maria.
Okay. Now we will begin for your bed bath. Step 2. Bring the necessary equipment to the bedside stand or over bed table. Remove sequential compression devices and anti-embolism stockings from lower extremities according to agency protocol. It is to save time and energy. Close curtains around bed and close door to room if possible to ensure patient's privacy and lessen the risk for loss of body heat during the bath. Offer patient bedpan or urinal. It is voiding or defecating before the bath lessens the likelihood that the bath will be interrupted because the warm bath water may stimulate the urge to void. Perform hand hygiene to deter the spread of microorganisms. Loosen top covers and remove all except the top sheet. Place bath blanket over patient and then remove the top sheet while patients hold bath blanket in place. If linen is to be reused, fold it over a chair. To avoid unnecessary exposure of the patient and to maintain warmth. Remove patient's gown and keep bath blanket in place to provide uncluttered access during the bath and maintains warmth of the patient. Fill basin with a sufficient amount of comfortably warm water. Fold the washcloth like a mitt on your hands so that there are no loose ends. Having loose ends of cloth drag across the patient's skin is uncomfortable. Loose ends cool quickly and feel cold to the patient. Lay a towel across patient's chest and on top of bath blanket to prevent chilling and keeps bath blanket dry. With no soap on the washcloth, wipe one eye from the inner part of the eye near the nose to the outer part. Rinse and turn the cloth before washing the other eye. Soap is irritating to the eyes. Moving from the inner to the outer aspect of the eye prevents carrying debris toward the nasolacrimal duct. Bath patient face, neck, and ears, avoiding soap on the face if the patient prefers. Soap can be drying and may be avoided as a matter of personal preference. Expose patient's forearm and place towel lengthwise under it. Using firm stroke, wash arm and axilla, rinse and dry. The towel helps to keep the bed dry. Washing the far side first eliminates contaminating a clean area once it is washed. Gentle friction stimulates circulation and muscles and helps remove dirt, oil, and organism. Long, firm strokes are relaxing and more comfortable than short, uneven strokes. Place a folded towel on the bed next to patient's hand and put a basin on it. Soak patient's hand in basin. Wash, rinse, and dry hand. Placing the hand into basin of water is an additional comfort measure for the patient. It facilitates through washing of the hands and between the fingers and aids in removing debris from under the nails. Repeat actions to the other side of the arm nearer you. Spread a towel across patient's chest, lower bath blanket to patient's umbilical area, wash, rinse, and dry chest. Keep chest covered with towel between the wash and rinse. Pay special attention to the skin folds under the breast, exposing washing, rinsing, and drying one part of the body at a time avoids unnecessary exposure and chilling. Skin folds areas may be sources of odor and skin breakdown if not cleansed and dried properly. Lower bath blanket to perineal area. Place a towel over patient's chest. Keeping the bath blanket towel in place, avoid exposure and chilling. Wash, rinse, and dry abdomen. Carefully inspect and cleanse umbilical area and any abdominal folds or creases. Skin folds areas may be sources of odor and skin breakdown if not cleansed and dried properly. Return bath blanket to original position and expose far leg. The towel protects linens and prevents the patient from feeling uncomfortable. Place towel under far leg. Using firm strokes, wash, rinse, and dry leg from ankle to knee and knee to groin. Washing from ankle to groin with firm strokes promotes venous return. Fold towel near patient's foot area and place basin on it. Place foot in basin while supporting the ankle and heel in your hand and the leg on your arm. Wash, rinse, and dry, paying particular attention to between toes. Supporting the patient's foot and leg helps reduce strain and discomfort for the patient. Repeat the actions for the other leg and foot. Assist patients to prone or side-lying position. Position both blanket and towel to expose only the back and buttocks. Positioning the towel and both blanket protects the patient's privacy and provides warmth. Wash, rinse, and dry back and buttocks area. Pay particular attention to cleansing between gluteal folds and observe for any redness or skin breakdown in the sacral area. Fecal material near the anus may be a source of microorganisms. If not contraindicated, give patient a back rub. Back massage may be given also after perineal care. help patient to put on a clean gown and attend to personal hygiene needs to provide warmth and comfort. Protect pillow with towel and groom patient's hair. Change bed linens and dispose of soiled linens according to agency policy to deter the spread of microorganisms. And perform hand hygiene. Record any significant observations and communication on chart. A careful record is important for planning and individualizing the patient's care.